What if I told you that just one drink could reveal whether your body is at risk for diabetes, prediabetes, or even gestational diabetes? It's not a magic potion, it's part of a medical test called the Oral Glucose Tolerance Test, or OGTT. In the next few minutes, I'm going to walk you through exactly what this test is, why it's done, how to prepare for it, and what the results mean, so you'll know exactly what to expect if your doctor ever recommends it.
The oral glucose tolerance test is one of the most widely used tools to check how well your body processes sugar. It's been around for decades and is still considered the gold standard for diagnosing certain blood sugar problems. Whether you're being tested for diabetes, prediabetes, or during pregnancy for gestational diabetes, this test can give crucial insights into your health.
The OGTT is a blood test that measures how your body handles glucose, the main sugar in your blood. Here's how it works. You start by fasting overnight, usually for 8 to 12 hours. At the clinic or lab, your blood is drawn to check your fasting glucose level. You then drink a sweet glucose solution, usually containing 75 grams of glucose for adults. Over the next 2 hours, your blood will be tested at specific intervals to see how your glucose levels rise and fall. Why glucose? Glucose is your body's main source of energy. When you eat, your body releases insulin to move glucose from your blood into your cells. If your insulin isn't working properly, or if your body can't make enough of it, your blood sugar stays high, which can signal a problem. The OGTT is recommended for several reasons. Detecting diabetes or prediabetes in people who have borderline blood sugar levels. Diagnosing gestational diabetes in pregnant women, usually between 24 and 28 weeks of pregnancy. Checking glucose tolerance in people who have unusual blood sugar readings or symptoms like extreme thirst, frequent urination, or unexplained fatigue. It's especially useful because some people have normal fasting glucose but still have problems processing sugar after a meal. The OGTT can catch that.
Preparation is important for accurate results. Eat normally for 3 days before the test. Don't suddenly go low carb or high carb. Fast for at least 8 hours before the test. Only water is allowed. Avoid strenuous exercise right before testing as it can affect blood sugar. Tell your doctor about all medications and supplements you take. Some can interfere with results. Let's break down the test day. Step 1. Fasting blood draw. You arrive at the lab, and a nurse takes a blood sample from your arm to measure your fasting glucose. Step 2. The glucose drink. You'll drink a clear, sweet liquid, often compared to flat soda. Some people find it easy to drink. Others find it overly sweet. Step 3. Waiting period. You'll wait in the clinic for the next 2 hours. You must stay seated, avoid walking around too much, and you can't eat or drink anything else. Step 4. Blood draws at intervals. Most common is a blood sample at the 1-hour mark and the 2-hour mark. In pregnancy testing, sometimes additional time points are taken. Step 5. Completion. After the final blood draw, you can eat and drink normally. Results can vary slightly depending on your lab, but here's the general guideline for the 2-hour value in a 75-gram OGTT. Normal, less than 140 milligrams per deciliter. Prediabetes, 140 to 199 milligrams per deciliter. Diabetes, 200 milligrams per deciliter or higher. For gestational diabetes, the cutoff points are a bit different and depend on whether it's a 1-step or 2-step method. Your doctor will explain based on your case. Advantages. Catches problems that fasting glucose alone might miss. Gold standard for diagnosing gestational diabetes. Provides a clear picture of your body's sugar handling over time. Limitations. Requires fasting and multiple blood draws. Time-consuming, usually takes over 2 hours. Some people may feel nauseous or dizzy after drinking the glucose solution. If your test shows prediabetes or diabetes, your doctor may order repeat testing to confirm. Lifestyle changes like diet, exercise, and weight management may be recommended. Medication might be prescribed if needed. If it's gestational diabetes, you'll work with your healthcare team to manage blood sugar during pregnancy, often through diet changes, monitoring, and sometimes medication.
The oral glucose tolerance test is more than just drinking a sweet liquid. It's a powerful diagnostic tool that can help catch blood sugar problems early, sometimes before symptoms even appear. By understanding how it works, you can walk into the test feeling prepared and confident. If you found this helpful, hit the like button, subscribe for more health explanations, and share this video with anyone who might be getting tested soon. And if you have questions, drop them in the comments below. We're here to help.